My paper is on nurse bullying. Um, Healthcare professionals are not immune to bullying. It can be passed down from superiors or between coworkers. When it is passed down between coworkers, it is called horizontal bullying. It can cause negative consequences for the nurse, patients, and the organization. The first step with dealing with nurse bullying is to develop a clear process for when it does occur, and we need to understand why it takes place. We also need to find solutions to solve nurse bullying. The one solution is it entires the whole healthcare industry. Another solution is getting rid of the hierarchy of the healthcare system, nurse educating, mentors, and workplace cultures and policies. For my first article, it says that there is more than 50% of nurses have experienced horizontal bullying. It is more likely higher than it is because it is underreported. And like I said previously, some solutions are eliminate the hierarchy of healthcare, nurse education, mentors, workplace cultures, and policies. My second article is a study done that did an online education modules on learner self-efficacy, where they pretty much had pre-licensed nursing students get educated about nurse bullying and how to prepare and also strategize of what's gonna happen. My third article it says we should know how to behave appropriately at work. We should know what our actions are doing to others. We need to be aware of our actions or how our actions are perceived by others. How and like how policies can affect the health healthcare bullying also. I would have to say I would have to agree with all my articles that the solutions are definitely to get rid of the hierarchy of the healthcare system, but also like nurse educating, like to educate the nurses, and like prepare them for what might happen after they get done with nursing school, and also just like explain that there's a chance that it might happen to you and how to like go about how to like document, look out for what's happening, and actually like how to report it too. And then also like mentors are there, like there's a lot of people like for nursing students we have preceptorships, so we have our mentors there and they can help us with like emotional support for our careers, but also like while they're mentoring us they could also give us like education too about like what to expect and stuff. And also like one of my articles told me that like nurse residency programs are a big help to when nurses go out into the professional lives, but also that doesn't really help with nurse bullying. And then like my second article, I also agree with it because like that if you get educated, you know what to expect and what to look forward to and know what how to act and behave, and if you need help, you can always ask for help. And then like my third article, yeah, we should definitely know how our actions perceived by others, and we should know like how to appropriately work in the how our behaviors are appropriate for the workplace, and like we should know what our actions are doing to others, but we should also know like what our policies are and if there are policies in place for the workplace for the place we work at, so that way we know when we should report something, when we shouldn't report something, and also for when we need just like something to look up for, like on nurse bullying. So, all in all, there's a lot of solutions to nurse bullying. We just have to kind of also like workplace cultures. I agree with that. Like, a lot of nurse bullying, I think, occurs because we're different cultures and we don't know how to like work with it. So I feel like we need to appreciate and celebrate all of our cultures in the workplace. And so, in conclusion, there's a lot of solutions to nurse bullying, and we should try to figure out which one's the best and get it going and figure out how to stop nurse bullying for the future.